Hi, everybody. I hope you guys are fine. I hope you guys are doing well um, and staying warm if you are in the part of the world where it's cold, like us. Yeah. So, you guys will remember that a few weeks ago, I think it was 2 episodes ago, I did a musings on organ donation. It was just a musings because something triggered that topic in my head. And in that musings, I was talking about a friend of mine who's been on dialysis for a few years. I'd said that I didn't know that I couldn't remember the number of years. And so I did mention her. Obviously, I didn't say her name. And a few days after the episode was posted, she contacted me and we thought, you know what, let's record an episode together. Because I'm talking about organ donation. Obviously, I'm not in that um, I don't need an organ as far as I'm aware right now. It's best to talk to somebody who's dealing with that particular situation. And so that leads me to my guest today. And I'll let her just say her name and then I'll tell you guys how we met and then we can just go from here. Okay, my lovely guest, tell us your name. I'm not going to ask you your age. Even the women don't like their ages, so just say your name and just introduce yourself.
Okay. Oh dear. Oh dear. Good. Good afternoon, dear audience. Oh my goodness, I should have researched the protocol.
You know, there's no protocol. There's no protocol. Just say hello, everybody.
Oh, okay. Oh, brilliant. Hello, everybody. Oh, I can go better than that. Hello, lovely people.
Yes. Yeah.
Okay. Hello, lovely people. Okay. So, I promise I'll go straight to the point.
Yes.
Okay,
Tell us your name.
My name is Sola Onalaja. So I'm dear Chinazo's childhood friend.
Well, let's tell them how we met too.
So that's it. I've already started. The way back from school.
Yes.
So yeah.
Okay, cool. So guys, that's Shola. I call her. You said Ade Shola. Me, I know. I just call you Shola.
Yes, Shola.
So guys, my guest is Sola Onalaja. We met in secondary school, Queen's College, Lagos, to be precise. Woohoo! Yes. Big up QC girls. And yeah, way back. So Shola, when so you left secondary school and came to the UK when?
Yes, 1994.
1994.
Yes, for like A levels before uni, A levels equivalent, and then uni. Because I was already in uni in Nigeria, but you know the whole.
Nice.
So now, so yes, and then when I came. So yes, so 1994.
1994, you came here.
Yes.
To do your A levels.
A levels and then uni. Yes.
And then uni. Okay. And then at what point did you realize that something was going on? Because we're about to get into the whole organ donation thing. So let's talk about what led up to where you are now. Yeah.
Yes. So when I was in uni, how far back can I go? When doing the A level equivalent, when we were required, go into some just general, checks.
Okay.
So they did mention that there was something, my kidney function needed investigating. It was there. I discovered that years later. I was just looking through documents, and I was like, oh, they did spot something, but nobody saw it or did any. I didn't even notice, but it was flagged in 1994.
Okay.
Like something had to do with my kidney function, but nothing was done or it wasn't any attention to it. But like years later, while I was in uni, I was diagnosed with high blood pressure. Now, this is why, one of the reasons why I'm doing this podcast, this is why I'm raising so much awareness. This is the reason why I'm here. It started off with the high blood pressure.
Okay.
So I was diagnosed with high blood pressure in uni. I never, ever took it seriously. I used to joke about it like, I'm single. I'm not paying school fees because those are people that had high blood pressure. People that were married or when it's time to pay school fees.
Yeah.
That's when they start getting high blood pressure.
Yeah.
I used to just, joke about it, never took it seriously. I only took my medications when I used to have really intense severe headaches.
Okay.
And then I used to have these headaches where I would take a pair of scissors and just cut my hair.
That bad.
That bad. And yes, and then I'll tell one of my friends' husband or anybody to please just help me level it up, or walk into any of the barbers, the men grooming things on the high street, and tell them to help me level it up. I didn't care. And that was the only time I took the blood pressure seriously. And then I'll take my medication and that's it. And then twice, because I'm leading to this journey.
Yes, of course.
As directly as I
No,
can.
you don't have to be quick. Shall
so
I
that
take your
people
time?
Can be aware.
Yeah, you don't have to be quick. We have enough. We have all the time.
Thank
so
you.
you're saying that
High blood pressure.
you discovered later on in life that
Yes.
it was pointed out that there might be something with your kidney function.
Yes.
But at that point, there was no follow-up,
Nothing.
go and check this out or
No,
nothing.
I even just discovered it written
On some medical
one
records.
of my medical things, yes, and that was like 1995
Okay.
or so yes, and I was like, oh, okay, but
So what you were diagnosed with was high blood pressure.
high blood pressure.
You had medication, but you said you
didn't
would take it
it.
from time to time.
Yeah,
if you're
because
headache.
when you're diagnosed with something that you don't really feel. So the only time I would think, oh, okay, the doctor said I have high blood pressure is when I have those headaches.
Okay.
These really bad headaches.
And
That's when
how
I'll
old were
take-
you then?
I would say this
Roughly.
was all pre like 20,
Okay.
like maybe like 24, 25.
Okay.
Because I was diagnosed at age 33.
Okay.
If my calculation is right. So
Okay.
anyway, how old was I? 2007. But anyway, that's fine.
Yeah.
So anyway, so before then it was high blood pressure. So I won't take my medications, and I only took it serious. And then I've had some really close calls with the high blood pressure. Like I turned up with my GP. And then I was just expecting like, just normal, tell me, take your medications.
And
I'm
go
increasing
away.
your man, and I'll
Yeah.
go. I had laundry in the washing machine. That was a very important climax episode of EastEnders that the whole nation wanted to. So I'm there like, let the doctor hurry up. And it was like, no, I need to call an ambulance. Even stroke victims do not have this high blood
That
pressure.
high.
And I was like, no. In my mind, I was like, no, this doctor, they started again. We did the unnecessary protocol. I am fine. I want to go home. No, I must watch that EastEnders episode. That's how unserious I was. I mean, while everybody's running up and down, the next time I'm in an ambulance, I'm being rushed to the hospital, they're struggling to bring my blood pressure down. I just wanted to go home. That was how unserious. So now, it got to the point where it packed up both my kidneys.
The high blood
High
pressure.
blood pressure. Now, I need
Okay.
to let the audience know, the listeners know, the number one cause of kidney failure and the challenges and the things, the troubles it causes, it's a major organ failure. Now, number one cause is diabetes,
Okay.
followed by high blood pressure. Now, I'm not diabetic, so my mom and my sister were on this kidney journey with me. Unfortunately, both my mom and sister have passed away. My mom and sister were diagnosed with kidney failure as well. It was high blood pressure. My mom and my sister are not diabetic. They don't have diabetes.
Okay,
Nobody
guys.
does.
Yeah.
So
Okay, guys. So I think that I was letting Shola just lead us down. I didn't want to start the episode by saying what exactly it was. I was just going to give you guys a journey down the walk Shola's been walking. So, but I'm sure if you're listening by now, you would have figured out that we're talking about kidney failure.
that leads to organ donation. We're
Kidney
gonna
failure.
get
Yeah,
there.
we're talking about kidney failure that leads to organ donation, because Shola is now waiting for, or has now been waiting for, an organ a replacement kidney, right?
Yes.
Is it kidney or kidneys?
Kidney.
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 Yeah.
For 18 years.
18 years. Yes.
Okay, so I've just given them the gist of what we're talking about.
Yes.
So you're saying it started with high blood pressure. So you're saying it's still high blood pressure.
Yeah,
That's
blood
what.
pressure, and
yeah.
it's something that could have been prevented.
You
Which is
didn't
why
take it
which is
seriously.
I'm really shouting from the rooftops.
Yeah.
If I had taken the high blood pressure seriously, and even my sister, when she got married, she got pregnant. The first one, her pregnancy, the high blood pressure as well. And then the second pregnancy with the twins triggered off this really dangerous high blood pressure. That's what packed up her kidneys. And my mom too, over the years, been trying to control her high blood pressure. And like the three of us didn't see it as something, we didn't know it's something that would lead
to
an
something
organ
so-
failure.
Yeah.
Yes. So I think people are more aware about the dangers now.
Yeah.
If I had known, I'll have taken my medication, slowed down.
Yeah.
Maybe, taking my fitness activity more. There are things you can do to lower high blood pressure.
So let's go back to what you were
But
saying.
I didn't do any of those.
So the time that you went to your GP, just thinking it was a routine thing,
Yes.
and you were rushed to the hospital. Was that the first time that you then realized, because you said your kidneys then packed up,
No,
right?
at that time my kidneys
We're still fine.
were still fine. No,
Okay.
functions were going down, but not at the point where they were just everybody. I think then the medical team have never even queried. Did they check my kidney for? I think they were all everybody, even the medical teams, the medical expert were just trying to
Get the blood
pressure down.
Okay.
So I think the kidney function was not. I think
was not even the
priority then.
Okay.
Yes.
So after that incident, so that was the first major incident that you had.
That I had with the high blood pressure. Yes.
The high blood pressure.
Yes.
Then what? Then how did things progress from there?
Then just progressed till I just generally started to decline. I noticed my feet were swollen, and stuff. And then I just used to get the really extreme fatigue. And I was really young, like I'm 31, 32. I'll be struggling to breathe. I said, okay, maybe it's my weight. I'll lose weight. And then, of course, slowly when I'm better, then slowly, like, for example, I will work instead of taking the bus, do stuff. And then when I'm better, and then I just noticed, like, serious, I was just so tired. And then my face was getting a bit puffy. But then, to joke, I'm a chubby, I'm a chubby girl. So I just thought, okay. But then apparently the signs were there that my kidneys were declining, but there was no blood test or medical test done. So the physical signs was just the fatigue. And I noticed my skin, some of which is one of the major, side effects I have up to now. Like my sense noticed like my skin just having like patchy skins and spots and everywhere. Like, what's wrong with my skin? And I was like,
just stop you there. So when all this was happening, were you still seeing your GP? So guys, if you're listening from out of the UK, you may not know what GP is, but it's a regular doctor that we go to. I don't know what they call it. I think in America it's family practitioner or something. So during that time, were you seeing your GP for the high blood pressure?
Yes. It was a case of every 3 months or every 6 months routine appointments.
So when you were noticing the symptoms like feeling, your feet being bloated, your face being puffy, skin and all, did you mention, was that part
yes.
At that point, the GP didn't mention anything about kidney?
No, nothing.
Okay.
No, maybe because this is 18 years ago, so I think a lot of, changes have been made now in diagnosis and things. I think a lot of things that were not in place 18 years ago are now in place now. So a lot of preventative and diagnostic measures are being implemented now, being taken now. So, but in those days, no. Just like, oh, my feet are swollen, so they'll give me some like diuretics, like water, retention tablets just to stop it. Like, kind of like, but it got to a point I couldn't wear certain footwear. I remember I stopped and I went into the men's store and I bought this trainers 2 sizes big, and that was all I was wearing. Yes, even in heat, in the intense summer heat, and stuff like that. And I remember looking for like men's, like size 10, 11 men's, so that my feet could like pair of like flip flops or something. And then nothing was diagnosed or nothing. Now until I'll never forget, I was in my childhood friend's, her elder sister, she had a baby, and I was staying with her. And then my goddaughter, and then I just slumped.
So when was this? I'm trying to find.
This is 2007. So
how many years from when you were diagnosed with high blood pressure to this?
So the kidney, I would say approximately about 7-8 years.
Okay, of you thinking it was just high blood pressure.
Just high blood pressure.
Yeah. Okay. So you went to. So you then went to see. No, you were staying somewhere. I
was staying, and I just slumped.
You just slumped.
Yeah.
Okay.
2 days before that, I was so out of breath. It got to a point like my friend, they'll wake up and like I'm sitting down with my back up against the wall. I couldn't even lie down. So I'm like, Shola, I think you need to go and see a doctor now. I'm like, no, I just wanted to get up and carry my goddaughter. That was where I was at that place, she was just a bundle of joy and everything. I just don't know. So that was what was going on in my mind. I'm like, okay, I'll go to the GP. I was saying that, I think, do I need to go to A&E? Something is wrong. But, I just kept fighting it until I told my friend, like, call the ambulance, and I just didn't remember anything.
So what year was this?
This was 2007.
2007.
Yeah.
Okay, so you slumped.
I just slumped,
and then they called the ambulance.
And I woke up, I was in ICU.
Okay. Oh, wow.
Yes. And then I was in ICU. So when I woke up, I came around, and when I was now like stable, like, I just woke up, and when I was able to talk, And then by the time I was able to take the oxygen, and I think I was intubated. So by the time they took the tube out and everything, I was now stable. And then I now, like, the medical team, like the nurse and the doctor came and said they're going to come and speak to me. I was in Barnet because I was the closest. So they're like, some team from Royal Free are coming to speak to me and tell me something. Like what? So I'll never forget Dr. Cross and another colleague of ours. They came, sat down, held my hand, and told me my kidneys are failed, both kidneys, and it's really, really dangerous. They told me the creatinine level was in, I can't remember the exact numbers now. I don't want to, but it was in the, let's use this as a reference. Like, for example, like, we have kidney failure, stage 1, stage 2, stage 3, then end stage. And then the marker for end stage for the creatinine, which is the toxins in the blood, is like 800. You at the moment are reading 2,000 and something.
What?
Which is,
What?
we need to take you now. And when you get to the registry, straight into theater, we're going to put a stem in you, and we need to start taking some toxins out of your blood now.
To get the toxins down.
Out, yes. So we need to put like a catheter or something, and then later on we're going to fit a fistula. So you're going to be having, explain. At that point, they were telling me now my kids
you were thinking. So hold on. Let's even stop, because
So that's it.
This. So were you by yourself?
I was by myself. Yes.
And how old were you then?
I was 33.
So you were 33.
Yes.
Thinking, I slumped. I don't know what happened. Maybe my body's just tired. Maybe this. Maybe that. And then they come and tell you that you've had kidney failure.
Yes.
And not only have you had kidney failure, you are like, where you're at is the highest.
And the one they're using was like end stage critical and
God
stuff.
forbid.
So that's even the thing on my diagnosis. When I have my doctor's letters, so it has my name, my medication, and my diagnosis. So it's end stage kidney failure.
So you were
blah blah blah.
had gone to the
So that's in both kidneys
had packed up.
Now I need for the audience and for the listeners. This is really important as well to make sense of this. Now and in 60 seconds to explain this, to make it make sense. So we all know about the major organs in the body. You have only one brain. So what happens if that brain stops? You have only one heart. So the same thing. So now there are 2 kidneys. Every single human being were born with 2 at conception. Now, only one needs to work. The other is just on standby.
It's Jara kidney.
Jara kidney, that's it. So we don't know how it's the higher, or Almighty, the higher being decided to create it like that. Why didn't he create 2 hearts or 2 brains? Or, every single organ has like a reason why they were created that way, and stuff. So the kidney is there as a standby. People have lived till their 90s or 100s with only one kidney. The other was just doing nothing. So as in, there are people that maybe as a trauma, like maybe a road accident or something, the other kidney automatically starts working. They're not even aware, it just kicks in, and then the other one is gone. Now, in the case when both fail,
are gone.
It's really, really
so no
serious.
Spare, no nothing.
No spare, nothing. So before the days where there was no dialysis, I think it's like 3 weeks, and the patient goes into a coma and they've gone.
Because the kidney.
Yes, when there was no therapy, no treatment, like no dialysis to take place. So there is a treatment called dialysis. It's a machine that takes place of the kidney, but you have to connect to the machine. So now everybody's kidney is working 24/7. Right? It's working like you, Chinas, or your kidney is working non-stop. Now that's one. The other one is just there, just waiting. So once anything happens, the other one will just kick in and start working. So, but dialysis we cannot be permanently on the dialysis. So maybe we do 5 hours, then stop, and then we take a break, and then do another one. So some people do 3 days a week, some people do 4. I do every other day. So I do Monday, I take a break on Tuesday, then I do, so it's one every other day. So I've been dialyzing for the past 18 years.
Okay, so let's go back to that fateful day.
Yeah, so back to the day. So
that fateful day, so they took you in, as they said, that they had to, into theater.
Yes.
Did whatever they needed to do.
Yes, so they took me to Royal Free.
Yeah.
Yes, so now, so they tried, yes.
Did everything.
Everything, and then I started, so they did, yes.
So since then,
and then
you've now been so dialysis is doing what the kidneys.
That's what the kidney is supposed to do temporarily till you get a donor. And then people do pass away whilst waiting for a donor.
Why is that though? But if
because like I said, they are complicated. When one organ fails, all the other, everything is connected. The cardiovascular is connected to the endocrine. The endocrine is connected
but
to
I'm
the
thinking, I think why
neuro.
was that?
So every system is designed.
I
So
get
when
that, but
one,
what I'm asking is,
yeah, sorry.
if you're on dialysis, right, and dialysis is doing what the kidney should be doing.
Yes. The
Do you see what I'm saying?
oh yes, that's the very important question that even we patients, the first thing we too want to understand once we start this journey,
Yeah.
it's a temporary thing.
Okay.
At least we are even lucky. People that have liver failure, is either they get a liver transplant or
that's
they
it.
pass away while they're waiting for a suitable liver. They'll just try and keep them stable and comfortable. That's when we see the skin, they turn yellow or the everything. There is no thing to remove or sustain until they while they're waiting for a liver. So we have something that can filter, take out the toxins and everything. We don't know what to, how grateful we are to this team and the man. Apparently, he passed away not too long ago. The guy, the doctor
That came up with the
dialysis in the, I think, early 60s. So before then, it was just a death sentence whilst one's waiting for an organ. So at least we are. But whilst, just the toxins just overpowers and complications. It affects the other organs, starts to shut down. And, different patients have different
thresholds and body,
and stuff with that.
So you've been on,
yeah.
you know where I like how we're talking about this thing, and it's like it's not as serious as it really is. So you've been on dialysis for 18 years.
Yes.
And you dialyze? How do you call it?
Yeah, dialyze. Yeah, dialysis.
When you talked to me the other day, you said, I'm going to dialyze. I'm like, what is Sola talking about? Because my understanding is that for you to have dialysis, you have to go into the hospital.
Yes.
They attach the machine and do whatever.
I have a fistula, or I'm showing China's I have the catheter now.
Okay.
Because my graft, the fistula on my arm is not working. I had a fistula. For 17 years and still having problems.
What's
and
a fistula? What is a
fistula?
Okay,
let's show you.
An incision.
It's like a tube in. They take the arm and they take a vein, and I'm showing fistula. I'm taking off my.
No, you can just tell me.
Or
tell
you
me
can
what
see.
It is.
So see.
Yeah.
And so there is they take a vein and an artery, they join it together. So we put in 2 tubes in, 2 needles, and then we connect it to the machine.
Okay.
And then so there is in the venous and the arterial. So the arterial
that has
needle.
To be there all the time.
No. We take it in, and then when you finish, you take it out.
Okay.
And then so you connect we put the one needle in, that's the arterial, and then another needle in, that's the venous. So you secure the needle, then you connect the two to the machine. So it takes it out. Okay. The red one is the arterial, so it goes in. You see the blood going in, and then it filters the blood. And then returns the clean blood. It takes out the toxin, which is what the kidney is supposed to do, and then all the urine and everything, and then it returns it back. Hence the 2 ports.
So dialysis. So let me understand this.
Sorry,
me. I'm very.
And then when you finish, you disconnect.
So let me understand this.
Yeah.
So dialysis is you're taking the blood
out into the machine,
and the machine filters it.
It filters and returns it.
Oh.
You're supposed to do it 24/7, but it's not possible.
Yes.
We cannot be attached, so we have to stop. Be careful what happens in between dialysis. Make sure you don't put on too much fluid. Of course, the toxins is going to build up because it's supposed to be doing it permanently, but you can't. Yeah. And then stuff. So in between dialysis, we have certain symptoms like. When we call fluid overload or toxins overload, which comes in sometimes different tiredness, like, breathlessness, swollen limbs, puffy face, the lesions on the skin and stuff. You get on the machine, and so, yeah.
So that fistula that you had for 17 years stopped, it wasn't as effective, or it wasn't working?
In fact, I had a good fistula. There's so many... So
what happened?
many.
What happened with that one?
Oh no, the fistula was just getting like aneurysms.
Okay.
There are different issues, but mine. I had an award-winning fistula. Even the nurse laughs when I call it that. It behaved itself, for such a long time and everything. So yeah, okay, fine. I had surgery. To be fair, I had a fistula. 2007, and I had surgery 2011. I woke up, the fistula wasn't working. So they had to quickly take me to theater. put an emergency line in, and then gave me another fistula. So I've had 2 fistulas in,
which is still
yes,
very
in
good.
17,
Yeah.
which is very good because there are people that struggle. People have weak veins or weak arteries. The fistula would not. Then they put a graft, and the graft will get infected, and if it out, then they put the catheter. Then they have to access the groin and everything and stuff. So my mom used to really struggle with the veins. I mean, it was so, but mom was very brave. Mom hated needles, but it was so difficult needling for dialysis.
Yeah.
They had to first of all numb the area before they put the needle, and then you have to, sometimes you have to try like 6 or 7 times, for 6 or 7 needles every dialysis. Sometimes I have to wait, put an ice pack, and then I'll just sit with mom, tell her to wait and everything, and then the nurses come back and try again. But there are days when with mommy would turn up that's my mom, for dialysis, and the needle would just go straight in, like, thank goodness. So everybody's patient journey is why organ donation, there's so many things why organ donation is so important.
So now that the fistulas, you're no longer using the fistula, you're now using the catheter.
So this is it. So whilst we're waiting to use, so I'm now waiting to, I have the catheter now. I just wanted to, hold on. I have all this.
Yeah, just show me. You can show me a little bit later.
Oh, later. Okay, brilliant.
So now you have the catheter.
I have the catheter on, yes.
Okay.
So, yes.
So again, you connect that to the machine.
Yes.
Okay. What's the difference between the fistula and catheter? I know I'm asking you medical terminology. What is the difference?
Okay. This is the catheter on my chest. Because I've covered it for safety now.
Yeah.
So, I told you about the 2. The red and the blue. So just like with the fistula, it's inside the arm. Right, there's a surgical procedure to do the fistula. So we join an artery and a vein, and then the graft is the tube, like attached to the artery and the vein inside the arm. So you now connect the needle to the fistula, but the catheter is like a catheter is a line on the chest.
Okay,
I can see. I'm showing you the picture now. Like this is what is on my chest because I've wrapped it up. So this is what is under the gauze. So there are 2 ports. So the red one, I connect the tubes on the machine to this 2. So the red one takes it out, and then that's the dirty, the bloods with the toxins and everything. And then the dialysis filters, which is what the kidney does, and then it returns it through the blue. That's the clean filtered blood, and then it does that for 5 hours.
Okay, so you now dialyze 5 hours every
other day, alternate
every
days.
alternate. Okay.
Yes.
Okay.
So that's what the 2 pots are. So there is a whole procedure for flushing, locking, disinfecting. You have to flush it with saline, lock it, and even the same care for the fistula as well, or the graft.
Okay, so you now have the dialysis machine in the house.
Yes.
Right? So you don't have to go in.
Yes.
We thank the National Health Service. It's the National Health Service, isn't it?
Let's
talk about the NHS, because when people talk about, guys, if you're listening from out of the UK, National Health Service, I always say the NHS is a National Health Service. People have complaints and complaints and complaints about the National Health Service.
My goodness.
But we do not know how lucky we are
to
have the national. So, Sola, you are in your house. You have the equipment to dialyze 5 hours. Can you imagine if you had to be going to hospital every other day? Yeah, but I'm saying that was still your life.
That was my
even as we get older, because as we're getting older, body is getting tired.
Oh yes, I did. For the first 8 years, I was commuting. I was on different slots. I was on the early morning. I had to be at the dialysis unit for 7:30 in the morning, because you had 3 different slots. There's the early morning, afternoon, and twilight. Every dialysis unit in the UK, so whichever one's suitable, so because obviously I had to work, for work commitments, everything, so obviously there was a time when there was only space available was afternoons, and then another space, and I prefer twilight, so at the end of the day, so I could walk during the day, do whatever I needed to do during the day, then head towards the dialysis unit. So I did that for 8 years. Every other day. So I've been, I did every day for 8 years, so now I've been dialyzing now for 10 years now, over 10 years successfully at home. But I still have to go into hospital, of course. Of course, maybe after I've had surgery or I've had a procedure, like when I had this catheter in, and then when I had problems with the car got infected in hospital. And then there are times when the doctor will summon me into the hospital, like, we need to get your toxin levels down. So we need to monitor you for 3 months in the hospital. Maybe, or there are times when they'll just want more, dialysis or, and then they'll discharge me back home.
Yeah,
but
but
I'm at home, so I
for the
just get
best
up
part,
and do
you're
it
in
in
your
my
house
room.
and you,
Yes,
yeah,
and I have a whole team. There's
yeah.
the technical team, there's the
And you
renal
can be
team, there's the
watching your
home
TV. You
team.
can be watching TV and doing things,
Yes,
right?
and stuff. It's just so convenient.
Yeah.
Yes, and then but a lot of patients, obviously, and what we call there's so much to cover, with this journey. I'm a peer support, which is a charity group, and where we talk to patients. For example, we tell patients about home dialysis. The patients are like, no, 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 no. It's not safe. There's a reason why you have dialysis unit. No, it's very dangerous. And they were like, meet Adeshola. She's been dialyzing at home for, and they're like, what? We thought she was the staff. And honestly, being horrible, being a bit chubby has a lot of advantages.
Yeah, because,
Apparently,
yeah.
I do not look like a dialysis patient.
No, I will. I don't even know what they look like, but I would never. I
Apparently,
wouldn't
did
think
not
that
look-
you. I wouldn't
so
even
they're
think that you
like-
had anything.
So yeah, so they introduced her like, am I a patient? I'm like, yes, she is. She's been dialyzing for now, 18 years. Like, what? So they now pay attention. They want to listen. Meanwhile, the doctors have spoken, the transplant list have spoken.
yeah.
But when they see somebody walking, so that's why I'm so grateful for the peer support, for the NHS. I mean, we don't get paid. It's a charity thing.
Yeah.
We get £20. But I don't even care about that. My goal is the patients. Like, they need to understand, like, look, there is hope in this journey. You have a team looking after you, because we're talking about the NHS here and all
course,
this, while waiting for an organ donation. So there's the peer support. So they talk to me like, you can do it. I've been dialyzing now for 10 years. I've never had any emergency situation. The only thing is when I'm dialyzing, I lock the door, but I don't put the chain in case
Just in
the
case.
emergency service need to break in, which has never happened in 10 years. And just like in the dialysis unit, if there's any issue, and I'm just talking about, because there's so many things to cover. But
course.
if there's any alarm, just like when the nurses will come, they'll try and sort it. But if not, they'll just turn off the machine and then come back the next dialysis. So I'm speaking to the nurses. I'm trying to override this alarm, or I'm trying to override it or disable it. Like, okay, fine, I can't. Okay, switch the
Just switch
machine
it
off,
off and then,
either come to the unit or we'll send the technician or the nurse will come to the house, depending on the time. Like if it is 1 in the afternoon, so the nurse can still come. But if it is 2 a.m., then I'll just wait till the morning when the nurse will come. And this is all on the NHS, all free.
NHS is amazing.
And I
don't care
will
what people-
take you to the room and look, it's not the dialysis machine that is like, maybe depending on the brand, maybe the Nikiso, I have the Fresenius now, maybe about 6,000. That's the cheapest part. Look at the filters on the wall, the reverse osmosis machine, the softener, the pump, and all the things that need to work for the whole
thing to
dialysis,
work.
the reverse osmosis process, the filtration, the ultrafiltration, the water that comes into the house before it gets to the machine, because it can't kill any small little thing. So before the water gets to the machine, you don't know what it's gone through. It's all in my room, all set up.
we're thankful.
Honestly, we're all set up. So
We're-
they
we're
set
thankful.
up the hospital thing in the room to stop the patients. Patients even, they're like, no, we don't want to. They're like, we'll do everything for free to make it more convenient for you. So
Okay,
I
let's
just
talk
get
about-
up and go into the room.
and
Sorry.
do it.
And do it, yes.
Okay, so let's talk about. So you've been waiting for an organ for
Yeah.
18 years now.
Yes.
Let's talk about organ donation. So let me share my
And that
experience.
is why we're here.
Yes. So when I did the musings, I had various responses, right? And I made it very clear when I was doing the musings that I wasn't trying to convince anybody or judge anybody for whatever decision they make, right? But the responses I got, and I expected some of the responses.
Wow.
No, one of them was, no, I'm not going to join the organ donation register because when I die, I want to go with all my organs, right? Okay, so when you're going to heaven, right, we all want to go to heaven.
Yeah.
And this God that created you surely can give you 10 kidneys or 10 hearts in a bit, right? So we serve a God that can do magic. So why are you worried about carrying all your organs to heaven when you go to heaven?
I'm sure but I don't know how I will have put it in a very respectful, dignified way, but people do not go to the other side with their vessels. It decays and it disintegrates.
So that was one of the things.
Okay, well.
Some people said, no, I don't want to be mutilated when I die. I'm like, but you're dead, so does it really matter? As in, if they cut me open and take my organs. Then there were some people who said, you know what, I've just never thought about it. And I also understood that because because I'm talking to you about this because I know you. If I didn't know somebody that needed and I know you and I have another friend who's on the waiting list, a guy, if I didn't know you guys, it may not be at the top of my thought process, right? Oh, let me go and register and be an organ donor. By the way, I'm registered, right? So I got a lot of people that said, you know what, I didn't even think up. It's not that I don't want to do it. I just haven't even thought about it. But I was saying to you that the whole point of this thing is to raise awareness. So if you haven't thought about it, then please start thinking about it.
Thinking about honestly, because first of all, in the case of for what I know about the liver, when I speak to other patients, and I found out that, for example, I spoke about the kidneys. I just let's use two organs.
Yes.
The kidney, that is the spare one. It just doesn't do anything. The other one is not doing anything. So people have successfully donated kidneys, and they are living. Of course, before they remove a kidney from an healthy person, whether it's somebody's brother or partner, they would make sure, if there is one thing, like, oh, maybe the person has small high blood pressure too, they would not. Or the person is always getting malaria or something, or they'll have to make sure the person is a certain, quality of health, because they won't want to jeopardize anybody. Why would they want somebody to go on the journey they're trying to remove somebody else's from? So why would they do that? So this is where, things are also considered as well, number one. And it's not everybody that even wants to donate that kind of suitable candidates anyway. Like, for example, they're my cousins, my brothers, everybody. So I'm going to go into that as well, which is very important.
Yeah, let's talk about that.
We'll talk about that. So there are many, it's...
So with your journey,
my
since
journey,
we're going personal, with your journey, because my friend who's on dialysis, yes, I think he's only been on the waiting list for not too long, right? Not too long. But he kind of we were talking about family members. He said that, family members have offered, but he's the one who's refused.
Same here.
Right? He's the one who's refused. He said he doesn't want to feel responsible, which is what you were just talking about. He doesn't want to for if anybody. So in your own case, did you have that? You said that you also refused.
Yes, I also refused.
Why?
But I just have to say that I do it. But right now, I've been suspended from the list. Oh, no, it's not. It's not what everybody thinks. I use the word, because, I did mention that the high blood pressure is what caused my kidneys to fail.
Yeah.
A lot of my friends too, that, they just, like, the ones that know, like, no, okay, Shola is on dialysis. But what people also don't know is, like, I'm also, like, in a cardiology. I'm a heart patient as well. The high blood pressure, that's nonsense high blood pressure. Not only did it pack my two kidneys, it damaged my heart as well. Okay. So that was the news that actually came to me
to share.
Before taking me to the Royal Free to start, was that they held my hand like I shouldn't be afraid, but that not only are they working on saving my kidneys, but my heart as well. So as soon as they've stabilized me, I have to go straight to cardiology. My heart is something. I'm like, wow. So right now is my heart valve as the problem that is now struggling, and stuff, so which they're dealing with. So depending on my heart test, they will suspend me. So I do my echocardiogram and stress echoes and scans of my heart. So depending on the result, I'm on the transplant list. But then if I have an echocardiogram and there's some issues, then they will suspend me.
Okay,
pending. So that's why I needed to explain that. So you see why? So when I'm back on, it's important to, like organ, as in now we Black people.
Yeah. So I think let's just assume you're on
the list now.
On
yes,
the list.
Yes.
You said that people had offered, family members had
Yes,
offered.
family members.
So why did you, at that point, why did you not accept the offer?
At the point where because I have a choice. There are two types of donors. There is a living donor and a cadaveric, like a deceased donor. So when you're on the waiting list, that means when a waiting list is actually when you're on the list for a deceased donor, an available donor.
Yeah.
But if you have family members or somebody that is willing to donate, they would test them. You don't need to be on any list. So you just bring people forward, and they will get someone. As far as the person is a blood relative, and then even if the person is a blood relative and a blood type, that's number one. Number two, it has to be tissue match. That's also very important. So the person could have the same blood type and everything, but they teach you, because there's so many things.
Yeah, but in your case, 'cause
So
I'm trying
okay,
to
so
go back
now,
to it.
so there are two things
Yeah.
people need to understand about donating.
First of all, we have to get people to even
To donate,
to even put their names on the list first.
yes.
So
Put
then the
name
medical
on
people
the
can deal
list.
with
Yes.
all that.
Okay,
all
so
that.
so putting,
Yeah.
to encourage people to donate.
That is what all I need to
do now. Okay,
Yeah.
forgive me. Okay,
So for you,
yeah.
when you were on the list and you had people, or one or two people who were willing,
Yes.
why did you not accept? And I'm just curious. Why did you not accept?
The same, just the same. Like, I just didn't want anybody to, what if something happens to the one kidney they have left, and then the doctors, reassures people that end up donating successfully. Like, the person that wants to donate kidney to you nothing has happened to them up to those points. They're fine. What cost you, they don't have it. In your own case, high blood pressure.
Yeah.
So if you know that, for example, your brother have high blood, which is exactly what is happening now. Both my twin brothers, one of my brother has sickle cell. So obviously it's not a suitable candidate. And then my other two brothers, because I told you my sister passed away.
Yeah, bless
so
her.
so I have we're 5 children. So it's just me and my 3 brothers now. And very close cousins. So one of my brother is got sickle cell, and then the twins, other boys, they've got high blood pressure as well.
So, yeah.
So I don't even want to put them for the first. And first of all, that's even
They're not even gonna.
they're not gonna pass anyway. So that's it. So that's also very important. And they want to. In fact, and then there's my dad that is 78 now. My dear dad, he even thinks he wants to render me incapable of not making decisions, and then he will just give his kidney whether I like it or not. He wants to sign a document where
Bless
they
him.
shouldn't get my consent.
Yeah.
And he's so
Bless
ready
him.
and he's 100% sure his kidney is going to be a match. He has seen all divisions in this one, that is 100% match. Yes. And it's like even the two of them. And then yes, I just like no dad, and but then again, daddy's had a slight kidney problem. The only surgery my dad has had in his life was to have his kidney stones removed, and stuff. But he thinks, but the doctors think that's not anything, but still, and daddy doesn't have.
So for you, it's more about feeling guilty.
Yes, but
and
then
worry and guilt.
Yeah, but it's getting to the point where I'm like, okay, maybe you should dad and my cousins, but I'm suspended. As I'm getting older and I'm getting like, I do think about it. Like, and then I'm like, when I was younger and I was on the list, and I'll be like, okay, let me take my chances on the list. But then, the reason why, which is why we're talking about organ donation. Now, when I was on the list before I was suspended because of my heart issues, why didn't I go? Because Black, ethnic people do not. So that's why we stay on the list longer.
That's precisely.
That is why I'm still here, even when I was on the list.
And that's why
when
I said,
was
let's go back
activated
to,
on the list.
That's
but
why I
yes,
said, let's
because
go
people
back
were
to
not donating. But whereas all my friends, my Irish friends, they were just dialyzing for 2 years, 1 year. I've had people that were just dialyzing for 3 months, and then they were called. They were, because people, are aware, but we are so scared. We don't even know about it. Then you have to plead with family members.
I think our culture,
yes,
religion, because I've heard the ones that want to use religion to say it's our bodies, we can't. You know what? It's funny how people switch things when it's convenient.
Yeah.
This kind of mindset, like we didn't create ourselves, so we shouldn't remove. Just like me telling you, Shola, I would have given you my kidney, but I didn't create myself. This is something that God created me with. Who am I? Do you understand? To take it and give you. So we have those ones. As far as I'm concerned, that's a cheap cop out. That doesn't fly. But there are people who think like that.
And then we're like, so when does empathy, compassion,
those
what
things. About
all the instructions and the biblical, teachings of, compassion, empathy? So when does it come in? I don't know. So those are, it's.
So what would you say
I don't know about perspective, really.
What would you say? Because we're going to round up soon. What would you say? Because for me, the whole point is raising awareness. Not even necessarily, rush and go and add your name, but find out about it, read about it, ask about it, talk to professionals about it, and then make a decision on where, make your own decision about whether to put your name on the list. What would you say to somebody who hasn't thought about it?
Okay, so please forgive me. I think I'm going to answer your question. I think I've kind of talked more about the kidney diagnosis itself, and the things. There's so much to cover. I think it's something that probably should have even been broken into part 1, part 2, part 3. But within this, what can we say to people is that
Our people.
What we should say to our people is that we shouldn't wait for it to happen to somebody that or to happen to you before, because when you don't know. I didn't even know where my kidneys were. I didn't even know where my kidneys. When they told me my kidneys, like, where am I? By the way, talking of these kidneys, I know where my heart is. I don't even know where my heart is. Where is my heart? Is it on my left or right? I didn't even know. So what am I trying to say? It's all about awareness. So you don't know. So a lot of people just do not know what this is. So please do not wait for it to happen to somebody that now everybody in my family are experts. They are willing to donate their kidney, their lung, their liver. But before that, nobody knew. Everybody will have been afraid. So number one to say to people, ethnic, people, is that don't let it wait to happen to you. Go and find out about it. And then God forbid, when it happens, you won't be talking about these biblical excuses you are giving. You will now be praying for a kidney. You will be praying and fasting. The same people that are saying, I didn't create my body. If it now happens to them, they might be listening and say, God forbid it will happen to me. God forbid.
Well, no,
I did as well.
Should it happen to? Yeah.
Yes,
Yeah.
So at the end of the day, you don't want to wait to God, God forbid, where you now start praying and fasting for a kidney. And so let's there are people that are in this situation. It's medical breakthrough. Look, people have donated successfully. There are clinics, there are transplant clinics that we see people that donated. I've got aunties. I have my Indian aunties, my Nigerian aunties, my Congolese. We're all over the world. But they've dialyzed successfully. 11 years, 12 years now, because on this 18 years, people that I met at the beginning, and I meet them, they dialyzed 3 years, they got their transplant after I started dialysis. So I bump into them 12 years later in the shopping mall. I'm like, I can't believe it. They're just thriving. And then their family member or the husband, the family, the partner, or whoever donated the kidneys, they're doing well. Now, please, this is also very important while we round up. If in this country, or surely on the NHS, if they take a kidney out, if you donate a kidney to, let's say, your sister or a brother, or you donate to your child, for life they will look after you, because they've taken an organ out of your body to give. So they're responsible regardless of what country that you live in.
Actually, that's important. Regardless of where you live in.
Regardless of where you live in.
That's very important to say, because I think that's also another worry that people have.
Yes.
I go on, some people, the ones that are willing to even consider it, what happens to me? God forbid, if something then happens to me, then who's going to? So you're saying the NHS will take responsibility for you. Wherever you are.
Wherever you are.
Okay.
Yes.
Okay.
Yes.
So
wherever you
ignorance, I people say ignorance. I say ignorance is not bliss, and I say that because walking around not knowing about things, and that's why I ask questions. Sometimes I'll ask you, like today I will ask you questions like a child, because I want to know.
That is
because you have to learn, you have to know and not be so petrified. And when this whole organ donor register, like you said, you can be a living donor, you can be a deceased donor. Nobody knows who's going to die tomorrow. I could die tomorrow. If my organ can save somebody else, what am I holding on to the organ for?
Can I quickly share an experience?
Yeah.
Because it's important. Because when I was on the list, I was called for a transplant, 3 weeks apart. So then, obviously, I was activated on the list. So we go to the clinics where they prepare us, like we're supposed to have a bag at the door. Because when they call you, you don't say, I'm in Scotland, or they give you like 30 minutes.
To appear.
Or 30 years, you have to get here now. you have less than 40 minutes. So I got the call and like, you need to get here, as in how quickly can you get here, like 20-25 minutes? I'm like, yes, and then my mom was here, may she rest peacefully, and everything. She's like, we're so dazed, like, okay, quickly call a taxi, and got there. As soon as I got there, they were waiting for me, just rushed me. My mom was so dazed that, like, they took my mom to a room, and then they will update my mom later. They quickly rushed me for some scans. The next thing I know, they were stripped me off, put some, and everything. So now this is it. So the doctors came just before we went into the theater, and I had stuff all over me. They were taking blood tests and stuff and all. I quickly went through like a scanner, like an MRI thing. They were just getting me ready. Everything was so super quick. Anyway, this is important. Please stay with me, audience. So the next thing, the doctors came and said, okay, this is all they can tell me. Somebody passed away just about, not up to an hour ago, and the family were the ones, he had signed the letter, and the family were the ones that gave the go-ahead, the next of kin. And then I'm the next person, the most suitable in terms of tissue, blood, and everything. So I'm the suitable candidate for the kidney. And then at this point, the kidney is still in the host, as in it's still in the person that passed away. So they're going to quickly take me in. I said, okay, fine. So they took me into that's what all the information they gave me. And then they now started wheeling me into theater. So while we were there and we're getting ready and stuff, and just before as they were about to take me in, before the anesthetics, and there were so many. In fact, it's a very, very, like obviously a very serious procedure and everything. And then they now came and said, we're so sorry. They just brought out the kidney and it's not suitable. It's damaged.
Okay.
And so 1 minute I was about to go into that. The next day I was changing. I was in a taxi going back home. The same thing. Now I'm on priority. So if that happens, that will now be priority. If that situation happens, so now I'm now on the very, very top of the list now. So I've been told to just be on standby. It could be hours, it could be days, or, but it's not going to be a case of maybe 1 or 2 years. So I should just be standby. And then lo and behold, 2 weeks later, I got a call again. This is the registrar. You need to start coming. In fact, do you have 10 minutes? I'm like, no, I can't make it in terms. Like, you need to, where are you? Stop what you're doing. Get in a taxi now. And whether you're on the high street or whether you are, drop what you're doing. Don't bother carrying a bag. Start coming. I'm like, I'm like, okay. I'm like, Mom, I can't wait for it. Because my mom was asleep. I'm like, Mom, I have to go. They've called me for a kidney again. I'm like, what was I? Mommy, please come and meet me in the taxi. And then as I was entering the taxi, I was actually outside. I called the taxi and I was standing outside. And as I was there, they called me and like, no, the kidney was already out. And the patient that was supposed to relieve it, that was in problem. So they wanted me to come in and rush. But obviously, it's not. They don't think it's not going to worth it. Yes. So that's it. So that's it. So yes, I have had very two close calls for.
And there'll be and the next one will be
definitely. I've just said whenever is the perfect time.
So now you're not on the waiting list now.
Now I've been suspended because of issues with my heart valve.
That's sorted,
with my heart valve. So once they fill my heart valves and my heart is yes, I'll be back on again.
It. Okay.
So yes, I have been called for a transplant twice. So yes, and then so that's it. So to people, what if that is those people tried?
Of course.
Those people, donated. They look at the family that, so, and then most cases, people donate when there's still, some people don't even want to donate after they've passed away.
Yeah.
So they won't even consider it. Some people don't want to donate whilst they're alive. Nobody prays anything happens to them. But then there are even people that, even when they pass, they don't even want anything. They don't even want. Yeah. So what if those people had made, there's people that are saving lives even when they are gone.
Yes.
That's a lot of my friends have had cadaveric, kidneys, and they are flourishing. I have an auntie, she was dialyzing, she's Nigerian, and like us, like you and I, Chinazo, she was dialyzing, she dialyzed for 29 years on dialysis, and then she's had a transplant, is it 9 years now? Yeah, 10 years.
And she's fine.
Yeah, oh yes. Yeah.
Shall I need to ask you, so it is crucial for people to really start thinking about it and really start considering. And I like that there is an option of, going on the register whilst you're leaving. And also there is the option of when you die. We're all going to die.
Yes.
So you have, for people that say, I don't know about when I'm alive, okay, what about when you die? there
Yes.
is also that option. Shola, what I
Yes.
want to ask you is, how are you always able to stay positive? I don't think I've ever spoken to you and you haven't been nice and soft and kind and positive. How are you able to maintain that energy
Oh,
with what you've been through?
for goodness sake, I'm sitting here talking to you. First of all, that's even number one. I'm still
Absolutely.
here. I'm still alive. I have a team looking after me. I have a family where, my goodness, should I even start with my sister-in-laws or my brothers? In fact, I'm so spoiled.
And your dad.
In fact, God deliver me from. If I, going to, I think he's going to listen to this podcast. So
We have to send it to Popsy.
oh my God, my dear dad.
Yeah.
Oh my God. I know my brother, my siblings, then you guys, my childhood friends too. They check up on me. So what excuse do I have? I'm still, and then obviously my late sister's children, they are my life now. My nieces and nephews. I have every reason. And I'm looking at my mom and my sister's picture behind you there. So I can even still hear my mom's voice. Like, I beg, like, stop all this nonsense. Behave yourself. Stop, sit straight up. Stop slouching. As in, just encourage me to say I know I have all the reasons in this world.
To be.
In fact, I don't even have a choice, and stuff. And I have a team, like, for example, let me mention Dr. Davenport, and, like people that just want me to have a transplant. Like, each time I sit around, like, oh my God, yes, no. He's like, no. He's as if he's so determined, like, no, this your heart valve must work. We must get this heart valve working. I need you to have a transplant. There are doctors in my team. Then I have the nurses that are my paddies, they are my crew, and then there are patients as well. Then obviously,
And the mentoring must that thing
yes,
that you do.
I do. Oh yes, the
mentoring
peer
must
support.
really, peer support must really
Oh yes,
give you some
does.
kind of, because you're giving back.
Yes. Oh
and
yes.
telling your story.
Oh yes. Even patients, like, I cannot just share this because we're talking about organ donation though. A lot of patients go through a lot, which is why we need to encourage ethnical. For example, there are all these aunties are like, no, they're not doing dialysis. Their children are begging. No, let them go and die. No, don't do dialysis. They're going to be putting needles in my body. What are you telling me about needle? No. And then they're like, meet Shola. Oh, hello, my dear. I'm like, oh, she's been dialyzing for 18 years. 18 years? Yes. And then I now greet them, good afternoon, auntie. And then I sit down. And then their children are looking like this. Even I don't know who is more shocked, the children or the... So that's the peer support. So that is how... We're also going to encourage that for organ donation. People that Nigerians or African that have done it, to speak to people, like, look at the people that have donated the organ, look at the ones, So
And another thing
it just is to create the awareness.
The awareness
I don't know if I'm useful.
no, of course you're doing it. And I'm gonna when I do this podcast, I'm gonna say, if anybody ever, and I hope it's fine, if anybody
100%.
reaches out to me and they want to speak to you,
what else am I doing?
Yes, I will put that. I will make sure that when I put that in the description, I'll put that in the description. Because I always keep saying, my whole thing is, if you have something to do with one of your organs and you are on the waiting list, why do you think you should be on the waiting list if you're also not going to be on the donor should somebody else need something? Do you see what I'm trying to say? Say, let me use myself now. If, for example, I have an issue with my kidney and I say, please, NHS, put me on the organ donor waiting list, right? I want to be on the list, please. I want an organ. But I'm not willing to put myself on the donor, on the list for if somebody needs an organ. You can't want something and not be able to also give it if somebody else needs it.
Oh, definitely.
It doesn't, do you understand? It's that sense of entitlement still that people have. Like, you want something, but you're not willing to give yours if somebody else wants it.
Wants it, exactly.
That's also another...
In my own case now, obviously, because I've been on blood thinners for 18 years. I've been on, I've been on tinzaparin, and I've been on EPO injections, on iron supplements, and, calcium. So obviously, I am not suitable to donate anything because I will not be doing anybody any good. I want to donate any liver or anything to anybody.
Or you're donating your voice and your positive
so
energy.
and stuff. Yeah. So it's just the time, and just to encourage. people. There's this thing about, honestly, and I don't mind being used. The fact is, as if, as just the fact that I'm like, they introduce me and they're like, this is Meet Adeshola, and they want to listen. They're not scared anymore. Okay, let's give it a thought.
Because you're somebody like them.
Yes, and then I'm like, okay, do you know, and I told, there was this Asian guy, he said he's not going for the surgery. What is fistula? How are they going to open his arm for? And everything. First, he doesn't even understand them sticking needles, attaching him to a machine. Then they tell him he's going to do some operation. I'm like, okay, can I? And I was okay. First of all, I met up with him so that I can see my arm. Oh, and you've been using the arm for 17 years. Yes. And like, look, it only takes like the surgery itself takes like, it's up to an hour. And then they'll put you in a recovery room for like maybe another 45 minutes. Then your wife also can come and collect you. Then you go home and then you can't use it for a while. You have to wait for it. When you get home, put a bit of ice pack. Is that it? Yes. And like, okay, I'll follow you to the surgery. And then your wife can come or your brother will come and like, oh, seriously, yes. Just to calm him down because he didn't know. So I think it's the same thing with organ donation as well. People do not know.
It's scary.
I hope I'm making sense, audience. That's why I'm giving this example.
No, you're making sense.
People are scared, but once they sit there, like, oh, okay, is that it?
And see somebody who's going.
Or see somebody go through, and then they'll be like, oh, and then there's a count. So that's why I do the peer support thing. But people will just be like,
that's
oh,
big.
Okay. And then just calm down. Oh, especially the elderly uncles and aunties. Oh my goodness, they could be so naughty.
That peer support thing is important. Especially, I wish it was something that could be done for this kind of talks in our communities.
No, this podcast, I'm actually going to talk to you, peer support about it. Like, I know this podcast, actually, I think I'll probably forward it if you, for them to like, and this is one positive that's come out of this talk now. Yeah. Let's have something for organ donation for the ethnic community. Let's have a group, a talk. Just like you have things in the auditorium for new patients. You call it patient education sessions. So let's have organ donation sessions.
Yes, because it's a transplant team. It's a petrifying thought process.
Yes.
So if you demystify it, and if people can see you, I'm looking at you and I know you, so it's not like I can see you and I believe what you're saying.
Yes.
So there needs to be awareness. There's so many things within our community that we just don't want to talk about because we're even scared.
Yes.
With the fear. I think fear is the worst thing for us. For us Black people. We're scared. We don't want to die. We don't want to accept that. When I do talks about death, people think I'm being morbid. But we're all going to die. I don't know why it's a taboo topic. So this kind of things, if you guys can set up something, that would be good.
Honestly, for example, people can donate the liver. That one is even more critical than we that we're going through. You ask me, how am I so positive? I have dialysis. There are other organ failure that they don't have any treatment. They are praying every day, like to be called before the deterioration. There's no dialysis. There's nothing to filter the blood. So the liver, for some reason known to God Almighty or a higher being, depending on our faith, when you cut the liver, the kidney, I said there are two kidneys. You donate, one is just on standby, so you can donate it. And the other one, the liver, when you cut the liver, the one that you cut to transplant would grow, and then the one that was in the host that was cut to also grow. We don't know why.
Really?
That's the only organ that does that. So when people are scared, but once people know that, if they just, when you transplant the liver transplant, so I think it doesn't even have to be a cadaveric liver as well. If it's a critical
cadaveric is for someone that passed
away, and stuff. I'm not even sure. Can I even? In fact, no, please, I don't want to mislead anybody. I've not even found out whether you can donate a cadaveric liver.
Who knows?
I'm not sure. But then again, I do. When you want a live liver transplant, when you cut the liver and you donate a piece and they transplant it, it will still save the person that to grow, and then the one that was cut in the host will still grow
back. Really?
Yes.
Isn't that amazing?
Honestly. So, but you just have an awareness, and but people. In fact, if I could donate my liver, I'm like, if I just take the whole liver, just leave a tiny piece for me to live
since
on.
it grows back,
wow. And if can you cut it and give two people? Can you cut a big chunk of my body? I can't.
You see, that was as we're talking about.
Because I've been through.
Yeah, you can't. But you see, as we're talking about the peer group thing.
Yeah.
It would really be good to have one for kidney to have one for
liver. Yes.
Do you understand those sorts of?
Because
Really,
people.
anyway, there's so much. There's so
There's
much.
so
We have
much
to
to
go.
do, but yes, because as we're speaking now, there are people that are hoping fervently, they are hanging on, praying that people will, and then the doctor will come and say, "Oh, we found somebody
that
for
phone
you."
call will come
That
through.
phone call will come. It's not money.
Yeah.
They're not praying for the lottery. It's an organ. And then let's not even talk about countries where, if you see how, do you know how important for the dear audience, if you've seen the Netflix documentaries or the horror stories where countries illegal,
Of course.
or to show you how critical or desperate people
Harvest,
are, they're harvesting people's organs, especially in poor communities where people disappear all because of their organs. People are paying money for organs. Also, but if people would just donate willingly, there won't be no need for crime.
True.
I think we just have to mention that. Maybe that will also encourage people to think about it.
Even you're talking about even in your country.
Yes.
After all, don't we have in the how many years ago the politician, or was it the former whatever who brought somebody here to take it. So that's desperation.
I even actually recognize all the doctors' names and
really,
people in that case.
That case.
Kind of like some of them are my consultants and things.
That's desperation, because some people say, "Oh, okay, he's evil. He was preying on a poor person." Yes, we have that bit of it. That bit of it is there, but there's also the bit that is desperation.
Yes.
So that Anyway, listen, Shola, this episode I'm going to dedicate it to your mom and your sister.
Oh,
because we're trying to wait. They're no longer here, but
yes,
if what they say is true, they're watching, they're listening, and maybe they're even chuckling at some of the things that we said.
I know my mom is like, should I stick to the point?
Shola can talk. Shola, come back to the point.
And then my sister will probably wanted to throw some legal terms and trying to be like, did she sign any legal documents? But has she disclosed anything that will not make her legally or medically liable?
No, we're
she
safe.
will be going with her legal.
We're safe. We're safe.
So thank you. No, that means a lot to me.
This is dedicated to them. What are their names?
My mom is obviously Sola Onalaja, and then my dad my darling sister, my cherished mom was Fekemi, and my cherished sister Adetayo Ndaguba. Yes,
you see, you always pronounce that.
Yes, my sister, she's Mrs. Adetayo Ndaguba.
Adetayo Ndaguba and Fekemi
Onalaja.
So this is for you. Guys, I hope you people have listened. I know we talk, but yes.
There's a lot to cover.
There's a lot to cover, and we even managed to shrink it into an hour plus. Shola, I just want to say thank you so much I know you don't like be anybody thanking you or whatever. I'm telling you thank you for taking out time and for just sharing your story and for all that you do. I'm telling you, because you will not know, other people that come and see, you don't know what the impact you're making in their lives. All that you're doing for people that are going through the same thing or people that are scared. And my prayer is that you go back on the waiting list at some point.
Thank you.
And that call comes and the right match happens. But in the meantime, we stay thankful.
Thank you. And I just create the awareness.
Yes.
And then please, audience, like I do hope, I know we're supposed to talk about organ donation, but there's so much to cover. I hope I tried my best. There's so much, maybe we can still break this into part 1, part 2, part 3. When there's a lot of awareness, please keep the blood pressure. Because you shouldn't even be talking about organ donation because as a bit people could, keep the, diabetes, make sure there is, do what it is, make sure there is no diabetes or high blood pressure. Let's first of all try and prevent that
happening so that it doesn't get to
and then it doesn't even get to start looking for organ donor. And then for those who found themselves with the diagnosis, please let's consider donating organs to save lives. So let's look after ourselves,
each other. Absolutely.
Regardless of whichever, let's look after each other.
Absolutely. Actually, you're right. Just to round up, you're right with what you're saying, and I think I would have to maybe find guests who are willing to share, because it's also one thing finding people who are willing to share. Some people have these conditions they don't want to share. But yeah, blood pressure is a big one. Diabetes is another big one. Yes. So what you're saying is if we can nip those things in the bud, then we don't even get to this stage where organs are failing.
Yes. That's
Yeah.
it. Yes.
Okay, guys. Well, thank you so much for listening.
Thank
If
you.
you need me to connect you to Shola, if you know, please, if you know me, send me a private message, or you can find me Nazor Sekos on Instagram, Nazor Sekos on Facebook. Yes, and I can connect you to Shola, guys. It's just to raise awareness for people to consider registering to be donors.
Yes.
Just even go if you're in the UK, just go on the NHS website. It's all there.
Yeah.
It's all on there. All the
And then
information you
all
need.
the concerns will be dealt with.
Yes, everything will be done. Right?
Dealt with.
Yeah.
Yes.
Okay, guys. So thank you for listening. Please share this. Subscribe for new episodes, and yeah, let me know your comments, please. Until next time, take care of yourselves and take care of each other, and be safe out there. Thank you.
Okay, thank you.
Bye, everybody.
Bye, everybody.